Chemotherapy. What is chemotherapy? After a breast operation, the laboratory will carefully test the cancer cells or tumor tissue that have been removed. Based on this research, the doctors and researchers of the MAMA team will suggest a treatment plan. Chemotherapy is often necessary. Chemotherapy is a treatment aimed at destroying the cancer cells or at preventing that they multiply. It is based on certain chemical agents, cytostatics, which are pumped intravenously into your bloodstream. In this way, they spread everywhere in your body. The agents do not only kill the cancer cells, but also healthy cells. Fortunately, these healthy cells can recover. The cancer cells die off. A complete recovery after a chemotherapy treatment can take quite some time, from 1 to 2 years. Chemotherapy also has side effects. The most frequent are nausea, fatigue, and hair loss. A special nurse will give you information about the side effects and what you can do about them. You will be given a booklet, the treatment guide. In it, you will find information about the side effects of chemotherapy. Why chemotherapy? The internist-oncologist will inform you about the aim of the treatment. There are 4 reasons why chemotherapy is prescribed. 1. Chemotherapy has healing treatment. Some types of cancer can disappear completely due to a combination of treatments such as chemotherapy. The treatment is then called curative. 2. Chemotherapy to reduce the risk that the illness will recur. Certain types of cancer can be treated efficiently with only an operation and then radiotherapy. But sometimes this is not enough. For example, some small cancer cells, micrometastases, could remain in your blood. Chemotherapy will get rid of them. The aim is to prevent the spread of the cancer in other places in your body. 3. Chemotherapy prior to an operation. Sometimes chemotherapy will be given prior to an operation instead of after. In this case, the aim of chemotherapy is to reduce the size of the tumor so that it can be better operated upon. The treatment is then called neoadjuvant or preoperative. 4. Chemotherapy to soften the consequences of the illness. Sometimes, a complete recovery from breast cancer is no longer possible. Then, chemotherapy reduces the place of growth of the illness in the body. The treatment is then called softening or palliative. The aim of palliative chemotherapy is to prolong your life for as long as possible, and most importantly, to ensure that you experience as little complaints or pain as possible. Does it work? Even if the treatment is successful, there is no 100% guarantee that the illness is completely gone or will not recur. Most of the time, the chemotherapy treatment works well, but sometimes it is only temporary. It can also only partially work or even not at all. The internist-oncologist will keep checking and informing you.